When people think of malnutrition, the images of adults and children suffering from malnutrition in Africa is generally what they think about. However, did you know that malnutrition impacts people in our own communities, as well as many people across the world in different countries? Malnutrition is a widespread problem, and unfortunately, many people do not know the scope of this problem. Well, for starters, 690 million people across the globe are undernourished. Moreover, 1.9 billion adults are obese. Obesity is a form of malnutrition that we don't give much attention to, so it's important that we target all forms. Spreading awareness is just one step we can take to ensure that we can prevent as many cases of malnutrition as possible in the coming years. I'm here today to speak to you about each of the different groups of malnutrition, but also to inform you about how you can make a difference. My name is Vindhya Adamala, and I'm an 8th grade student from Washington State. And here is my take on malnutrition. Malnutrition is one of the world's biggest problems. However, there's different groups of malnutrition. Differentiating between these groups is just as important as taking action against it. The first group is undernutrition. Obesity or being overweight is another group. Micronutrient-related malnutrition is the last group. These three categories are most commonly known around the world. Each of these different categories can be broken down and have a different effect on the human body. Undernutrition, for example, generates this devastating phenomenon known as stunting. Stunting refers to when you're below the average height for your age. Stunting-related malnutrition is often related to poverty or poor maternal health. This highlights the importance of having access to proper nutrition, especially when you're pregnant. Poor nutrition can negatively affect a growing baby and can also negatively affect their life after they're born. Another common condition for undernourished people to endure is known as wasting. Wasting refers to when you're underweight for your height. It often indicates a very recent or pretty severe weight loss. Wasting is also associated with kids and adults who have recurrent or prolonged diseases due to their condition. Wasting can also be a trigger from another larger issue, such as pre-birth malnutrition. Being underweight is also very frequent to undergo with undernutrition. An underweight child has chances of being wasted, stunted, or sadly in many cases even both. Having deficiencies in essential vitamins and minerals is also a common experience. In particular, undernutrition makes children more susceptible to illnesses and death. Obesity, on the other hand, is something that doesn't commonly come to mind when we think of malnutrition. However, obesity is becoming more and more significant in the conversation about malnutrition. For example, in the United States, obesity rates rose from 30.5% to 42.4% in the years of 2000 to 2018. This rapid increase in obesity is due to a mix of socioeconomic factors. I will be elaborating on those factors a little later on. When it comes to micronutrient-related malnutrition, it might seem rare. However, it's quite the opposite. Many people are afflicted with micronutrient-related malnutrition every single year, and it prevents their bodies from getting essential vitamins and minerals needed to further develop. A common example of this would be iron deficiency. 10 million people in the United States are iron deficient, and an additional 5 million have been diagnosed with anemia. In global public health terms, iodine, vitamin A, and iron are the most important, and their deficiency is a significant health threat. From areas of Nigeria to Yemen and many other places around the world, the most extreme form of malnutrition is severe acute malnutrition. Severe acute malnutrition takes the lives of many, including a lot of young children. It's an extreme condition that leaves its young victims very frail and in many cases even skeletal. Research findings indicate that severe acute malnutrition can be controlled at the community level using therapeutic, specially formulated, ready-to-use foods in children over the age of 6 months with no other medical complications. As you can see, we're starting to make progress, and the difference that can be made in lives battling to stay alive can really be ginormous if we pay attention to this dreadful issue. Malnutrition impacts can also be really devastating. It can have permanent impacts on lives, especially if you're a child. It can lead to diet-related non-communicable diseases, including heart attacks and strokes. You're also at risk for developing certain types of cancers. Permanent physical and cognitive damage can also be done. You're also sadly at risk for developing some more mental illnesses. And sometimes it's really hard to understand the magnitude of a problem until we see it right before our eyes. So it's time for an activity. As you can see on the screen, there are 3 people standing. These 3 people represent the worldwide population. Now you can see that 2 out of these 3 people have taken a seat. The last person standing shows us how much of the worldwide population has malnutrition. So when we convert this to the lens of speaking about everyone, we can see that roughly 1/3 of the whole entire population has malnutrition, which is a significant amount and is even more significant when malnutrition can be preventable in many cases. The ongoing COVID-19 pandemic has influenced our daily life practices, but also negatively impacted the lives of many. The rate of malnutrition is rising in our communities, and we must shed light on this issue. As you can see here, there has been a rise in malnutrition and food insecurity since the COVID-19 pandemic has started. Discrimination and socioeconomic factors also push certain demographics into a sinkhole of malnutrition. For example, people of color are at a higher risk of developing nutrition-based issues at a younger age and are less likely to receive treatment for it. Another major socioeconomic factor to consider is income. According to the Washington Department of Health, as household income rises, the amount of fruits and vegetables consumed in that household rises as well. As education levels rise, we see a similar rise in the consumption of fruits and vegetables. This allows us to see that malnutrition rates rise in communities with fewer income and lower resources. We also see that malnutrition rises all throughout the world on a daily basis. Gender is also a key factor that plays into the role of malnutrition. A woman is more likely to experience food insecurity when compared to their male counterparts. And Bill Gates called malnutrition the greatest lost opportunity in global health. Luckily, there's a way that you can make a difference. There are so many agencies working locally and globally to end malnutrition. Globally, organizations such as UNICEF, the World Food Program, and the World Health Organization, as well as many others, all work toward properly nourishing everybody. Locally, food banks help communities get the resources they need to stay appropriately nourished. I encourage you to donate to local food banks as well as global organizations as a way to help out. However, if you can't donate due to many reasons, there are also so many steps you can take. In the United States, approximately 1 pound of food per person gets wasted every single day. A simple way you can help out is by not wasting as much food at home. Telling a family, friend, or peers about this issue is another great way to help. I also really encourage the use of social media as a way to spread awareness, since many people revolve around the usage of it every single day. I have also made a website with reference materials and more in-depth information about this issue. The link is being projected right now. Now, I hope you understand that malnutrition is a worldwide issue and can often branch from another larger issue. Health discrepancies around the world lead to malnutrition. Malnutrition can also be found in people every single day. Malnutrition can also be broken down into different subsections that are often overlooked. But I also want you to understand that since malnutrition is so significant, the impact that it has is not just for people in Africa, but also someone that you may know directly. And as the leaders of tomorrow, it's really up to us to make a difference. So, let's work together to end malnutrition. Thank you.